Hello, my name is Alice Journo, and in this video, I will be sharing the key practical implications from my research on how health professionals can be better supported during and after extreme weather events. These events are becoming more frequent and more intense, things like droughts, floods, bushfires, and cyclones, especially here in Queensland. So, health professionals are expected to step in and provide psychological support, but how confident do they actually feel doing that? My research explored the factors that shape that confidence and what we can learn to improve future support. One of the key takeaways from the research is that what really boosts confidence isn't just doing the training, it's feeling genuinely prepared afterwards. So, this tells us that training programs shouldn't just teach information, they should give people the chance to practice what they've learned. And this could include activities like role playing real life situations, working through examples, or practicing how to respond in realistic disaster scenarios. It's important that this happens in a supportive environment where people can make mistakes. They can get helpful feedback, and that will help them build their confidence gradually. So, giving professionals time to reflect afterwards or having followed up session can also help them feel more ready and capable when they face real life events. The study also showed that professionals who believed in their ability to handle challenges, what we call occupational self efficacy, tended to feel more confident overall. So, professional development should focus on helping people build confidence in their abilities, especially those who are just starting out or who are new to dealing with climate related mental health challenges. This could mean offering mentoring from more experienced colleagues, having regular supportive check ins with supervisors, or giving clear and constructive feedback that helps people see how they're improving. And it's also important that supervisors and educators use positive, encouraging language because the way they communicate can either help build a person's confidence or accidentally knock it down. Interestingly, having lived through an extreme weather event did not increase confidence. So, people who've been through natural disasters themselves often bring valuable insight to their work, but personal experience alone isn't always enough to feel fully prepared to support others. So that's why training programs should help these professionals develop specific skills like how to talk about trauma in a helpful way or how to set healthy boundaries with clients and how to separate their own personal experiences from what the person in front of them needs. This kind of training can help them turn lived experience into safe, effective, and professional care. It's not enough to judge a training program just by who showed up or what topics were covered. What really matters is whether people leave the training feeling ready to do their job. So to check that, organization could ask participants to reflect on how confident they feel afterwards, run group discussion about their sense of readiness, or follow up down the track to see how the training helped in real life situations. They might also use tools like peer feedback or structured team check-ins to see if staff feel prepared to handle their emotional and unpredictable nature of climate related disasters. When it comes to getting professionals ready to support others during climate related disasters, we shouldn't assume that people with more experience or those who seem confident don't need support. Everyone, no matter their background or skill level, should have access to training and supervision that helps them build their abilities. One way to do this is by offering training in different levels or formats so people can choose what best suits their needs. And this helps make sure that all professionals across the board have a solid understanding of how to support mental health in the face of climate challenges. Training programs should be designed in a way that makes sense for the people and places they're meant to serve. So, in rural and remote areas, that means making sure the content is locally relevant, culturally respectful, and easy to access, even without fast internet. And this it could include mobile friendly or offline training options, partnerships with local health services or First Nation leaders, and running in person workshops in regional centers. Ongoing support like phone based supervision or peer groups can also help professionals stay connected and confident, especially in isolated areas where working alone can feel overwhelming. These kinds of flexible community based approaches can make a big difference in helping health workers feel supported and prepared, even in high pressure situations. Organization could think about checking in with staff about how confident they feel, especially after a big event like a flood or a bushfire. These conversations could happen during regular supervision or well-being checkups. Supportive practices like focusing on strength, reflecting on what's going well, and talking things through with peers can help professionals feel more capable and confident over time. Confidence isn't just a nice bonus, it can actually be a useful way to understand how prepared someone feels. That's why it might be worth including in that's why it might be worth including in bigger workforce planning and funding decisions, especially when it comes to building long-term resilience in health services. To truly prepare our mental health workforce for climate disasters, we need more than training. We need training that works, and this means building real confidence, hands-on skills, and support systems that reach everyone, especially in vulnerable regions. Because when professionals feel ready, communities recover stronger, and that means helping professionals build practical competence, develop self belief, and access support systems that are as resilient and adaptive as the communities they serve. Thank you for watching.